Important angle of a academic program or maybe associated service program that you call that now AIIMS is going to have a school of public health. I don't know how you are going to take this issue up, but I am very much interested, and the CMFM department is also very much interested to have it. So, in this regard, we had a meeting last visit. Dr. Joe Thomas is here from Australia, Melbourne. He is working there, and he has own institutions and a global expert in public health. He worked for a long time in WHO and finally settled in Australian environment for last more than 20 years. So having enough experience, global exposure, and especially in the public health. So I thought probably we could utilize his expertise to develop our skill of public health at the international level. And this is an opportunity that, yes, with a lot of people there having, and Dr. Joe is also from the soil of this India, and so he is from Kerala, and also here is having some affectionate towards the Indian soil, although for a long time he's around the globe. And in this, so we are, as he has shown his support, and for last more than I think 2 months, since his visit to this last visit to this place, Bhubaneswar, and he has developed the curriculum for it and started working to develop the School of Public Health, how it should be and all it should go. So he's giving input, and this is the second visit and shown his interest, enormous interest for this, and we are very much grateful and thankful for your visit again, sir, and showing your support for the AIIMS Bhubaneswar. And also Akriti is also joining from Melbourne. Welcome, Dr. Akriti here also, and she is with Dr. Joe at the same place in the Melbourne. So probably they will be supporting how this all course curriculum to develop, and any administrative all sort of support that we can get, global exposure and the standard that we can get from the Dr. Joe, and some technical help from Dr. Akriti, as she has undergone the Master of Public Health from Australia, the CAS curriculum and all. She would be able to help out. So these two people are they are in our background to support, and naturally we are also having our own expertise, but we want to have more global exposure, what is happening across the world and the other institutions, developed institutions, so that we could have the best model to develop here. And it's not the School of Public Health, means the public health in various departments also having challenge about the public health issues. So that's the reason few departments are involved initially. Probably later on we can have, depending on. So is to start with, CMFM, that probably they are the best person to look after all everything. But at the same time, so different departments should be also involved. What is, suppose the gynec department, as Dr. Swet is saying, that no, there are many issues that are in our community about the pregnancy, about female health, or all, so public health challenges in their domain. So we should address, and we should come up with, and if we are going to start the course curriculum about the Master of Public Health, so how we are going to create this awareness in the public, and then teaching program also. So that is, we have to develop a course curriculum and the human resources for the teachers to contribute their teaching skill for the students. So we'll find out how we are going to start the academic program. This is the beginning. So our in principle that we are going to start the School of Public Health, and then other, I think, logistics you have to work out. Logistics are various to no, mobilize the human resources, and then we have to have the program, the course curriculum has to be approved by the standing academic committee as well as the Minister of Health. It has to be brought to the SFC because some maybe financial issues and all. So ministry makes our and then ratification by the IBGB to finalize. So this is a 1-year program. Probably in the next March, April, we could be able to finish all this regulatory process. And how we are going to start, that is, we have to discuss in our discussion. After this, we can, and the different department, their role, how they are going to contribute in this as a teaching faculty, and what kind of public health, and then probably providing the School of Public Health, not that only teaching, but probably we should integrate with the services also. Some services, as already CMFM, they are doing their non-communicable diseases, they are running. So how to extend then other wings in the public health. So one, the academic, maybe that, going for a Master of Public Health degree, MPH degree, or maybe we'll be looking for to begin with the diploma, whether Dr. Joe was suggesting you can start a diploma program, or maybe some other with 6 months or 1-year program to begin with, and then subsequently you can go for a Master of Public Health when your internal structures and everything will be ready for taking up the students. And the internal, again, challenge, how we are going to take up the students. And then to creation of the academic post from the department, or maybe we can mobilize from other department to start this program. So that is the administrative or maybe approval from the other, our ministry to or standing academic committee through which we can mobilize where the academic post or maybe non-acad senior resident post or junior resident post will be mobilized with the permission to start with the academic course curriculum for MPH degree. There is another proposition that I'm thinking, instead of that it will take time to create the post for academic, but yes, there are many posts which are lying vacant for different, either in the department of CMFM or maybe other department, how we could mobilize. So we have to find out our internal, this is internal mechanism to start mobilizing the residency program for an academic program, academic resident program, and how many students probably want to. And this is just an open discussion with all, so the various departments, and also if we are going for a public health outreach program, our investigations also to be little bit supportive should be there. So how we are going to reach our investigation support to outreach, whether this different, we have at this moment different public health centers, outreach to public, providing the public support to different 3 already we have. And also we are having one, Balasar. So we are reaching very far away from this also. And there are a lot of propositions coming to establish the AIIMS-like center, this satellite center in Western Odisha, South Odisha, also a lot of pressure on me to start, but resisting that we really not in a position to stretch our hands for a whole Odisha to have many centers like Palasan and all. So that's one, because we need to strengthen our, and the load is very high on the SAMs. No, people, more than 5,000 people are coming daily. That's another challenge for us to address that crowd management and providing service, investigations, OT services, lot of things. So we are, it's a great challenge, health, in India. And it's not like Australia that you see only 10, 50 patients in a day. And we hear more than one resident, probably 100 patients, more than 100 in a day, or maybe on over 3 or 4 hours. So there are a lot of constraints to work on it, but yes, this would be, and our Jodhpur is already having a school of public health and also Rishikesh is having, and Raipur is also having. So this another 3 AIIMS, these 3 AIIMS already having, but I did not go through to understand their model, how it is running. Probably Dr. Patra and Dr. Farida and Dr. Sonu might be having some idea about how, whether the similar course curriculum, have they started MPH programs?
Yes, they did.
MPH, all three?
All three passed out.
So we have to look into that. It's not a mandatory that same program to be replicated in AIIMS. So we have our own, we can modify it also. We have that autonomy in our hand to start. Yeah, so if it is. So that regulatory part approval from the different committee, SMC, our standing and all, DBIB, that's my job to take it through. And but there are a few challenges that we'd like to hear. And here with us is the Dr. Chena is from the head of the department from dental department and the head of the department of microbiology, Dr. Your Mahapati Mishra is there, and also Principal College of Nursing, Ashapi Sethi is also very important resource person in this. They are doing a lot of public health, nursing public health, a lot of activity they are doing, very impressive, and a lot of research also. Research going is under the nursing is also quite strong and pursuing the PhD course in nursing and all. And they're always after me to allow for PhD course outside and all left, right in India, not all. But there are some restriction to allow. I'm not very happy to say that no to them, but we're trying to promote PhD programs, how it could be, and from the guiding department of the seeing and all various. So I request all people may introduce quickly and so that you can know their opinion. So introduce yourself and give your opinion regarding this, how we are going to contribute. To begin with, Dr.
Good
Chena.
morning, everyone.
Yeah, you can see that.
Dr. Ashok Dana, Professor from Department of Dentistry. This will be a good initiative, sir, at the community level. Can be helpful. School of Public.
School of Public Health. How we are going to contribute in this School of Public Health? Is a public health.
So parallel, we have a community dentistry department also. So various dental issues can be sorted out.
So basically, we are going to collaborate it and then to understand. Okay. Okay. So, Dr.
Yeah. Good morning, everyone. I am Dr. Vajanti. I am Professor and Head of Microbiology. In School of Public Health was also there in my previous institute in PGI Chandigarh. So I think as far as microbiology is concerned, we can, what I can think of just now is in outbreak investigation, which we are already doing, and that will be facilitated better with this public health, School of Public Health.
So I request not to go for a outbreak. That is already under compulsion. When there is outbreak, you are
Yes.
bound to do that.
Yes.
But at the same time, without outbreak, a continuous surveillance, public health surveillance system should be there in the place to early diagnosis and detect the impending outbreak. So that system, surveillance system has to be in place, public health. So there are maybe network we have to develop and then we'll be able to do it as a periphery. Yes.
Good morning, everyone. Good morning, sir. I'm Dr. Asha Pichetti, Professor cum Principal of College of Nursing. And we have BSc Nursing and MSc Nursing program, and we have a specialization in community health nursing currently. And it would be good, like students would be able to get good exposure under School of Public Health. Because the students are involved, students and faculty as well are involved in a lot of public health activities. Because ultimately everything is going to community and public, so that's what.
Yes. People are coming from public to hospital now. Yes, Dr. Singh.
Good morning, sir. Good morning, Dr. Jo, and good morning, Akriti. I am Dr. Shweta Singh, Professor in Obstetrics and Gynecology here at AIIMS Bhubaneswar. And I think this will be a very wonderful initiative. So women's health, it's always very important, and especially at the community level. Already Department of Community Medicine is doing good work and they have a lot of projects. We would like to collaborate. In many fields we can, like starting from adolescent health to menstrual hygiene, to pregnancy and related matters, because Odisha is actually the maternal mortality has gone up. So I'm part of the state health committee also, where we are trying to bring down the mortality and be in the review. So there is many things which we can contribute at the community level to increase their awareness. So pregnancy, then WHO has given a call for cervical cancer elimination by 2030. So probably it will be by, modeling has shown, by 2100. So we have many years where we are able to do a lot of work, screening, vaccination, their treatment. And then the geriatric gynecology is not taken care of at all. Very less we know about it. So there are, like from adolescent till geriatric level, there is a lot that we can do at the community level. So I look forward to it. It's a very required initiative.
So female geriatric health.
Pediatric health. We do not know what
Yes,
to add.
yes, yes. Very important area you are opening up. Good.
Because dementia is more among the elderly women.
Elderly. So we have data from ICU, but what's really happening in the community level, because lifespan has also increased from 77, 78 years now. But what is happening from 50 years when they leave our reproductive age till the time they are alive, we don't have much data. So that is a less explored field. We would like to know how is it that, what is their health, what is it that can be done. That's a very important area.
And Dr. Jo is also giving running a certificate course, diploma course in geriatric health in Australia.
Very good. We align in our interest.
Okay. So he is giving a diploma in geriatric health. So we can tie up for those. Okay, next.
Good morning. I'm Dr. Mukunda Sabre. I'm an additional professor in the Department of Pathology. So as sir and madam told, the role of pathology, in particularly at a community level in public health, will be mainly in a surveillance and screening programs, particularly few oncological cancers, oncology and non-oncological diseases, like in particularly Odisha, like anemias and hemoglobinopathies. In a cancer community level, screening can be done, particularly like ma'am told about cervical cancer or oral cancer, and maybe breast cancer with a triple assessment, in which the role of cytology and histopathology will be in additional put. There, in my previous institute in Tata Memorial Hospital, there was a successful stories like Barshi program. There's an outreach program in which the use of telepathology was additional with the central Mumbai TMS hospital was coordinating everything by the pathologists for the early diagnosis, as sir told. the most important thing is pathology is to help increase the diagnosis in that particular community or district or tahsil level. So that is the one thing. And in today there's a future is of AI. So in addition of AI and telepathology and the community outreach, it will be very useful to implement some programs.
You mentioned about the data and surveillance. Data increasingly now we're looking at disaggregated data. That's one part
Yes.
of it. And then on a national level, on a larger level, how do you integrate the data coming from the zoonotic infection, the human epidemiology? So these are some of the new areas that are coming up. Digital health, of course, but then how do you make sure that all the variables are talking to each other, the data we collected? So these are some of the emerging challenges for that.
Yes.
Because veterinary data is not integrated to look at overall data. Maybe this is one thing we have to look at carefully. How do you look at veterinary data with epidemiological data and disaggregated data? Because if you want to look at the health inequity, how which direction it's going, integration is important. For example, now we talk about Nipah outbreak. That probably linked with how do you look at these two together? Any other science we can pick up?
Dr. Aditya.
Yeah. Good morning. I am myself Dr. Amit Kumar Adya, Professor and Head of the Department of Pathology. And Dr. Mukund has already told you how pathology can help in this initiative. I think this is a very great initiative. And in addition to what he said, I think even digital pathology we can incorporate at various PhD level and other things where we can give them our diagnosis, and that will also enhance early detection of all the diseases. So we can set up this digital pathology kind of a center here and get inputs from other areas and extend our diagnostic services to those areas also. So that can be explored also.
Dr. Swayam Pragyan Parida, working as additional professor in the Department of Community Medicine and Family Medicine. So I think School of Public Health is a great initiative because during policy decision, our voices are not heard actually, the experts' voices are not heard. So the graduates, if they come up, they can have the say out there. And then second thing, community engagement is also not there. Community voices are not heard. What is their opinion? That should come up also. So maybe the graduates will take up this to the national level, and in global perspective also the health professionals can work better. Diplomacy. Thank you so much.
Myself, Professor Bhagirathi Dwivedi, Professor of Pediatrics and as well as Associate Dean Research Institute. Actually, to see a common front, I feel few areas are important, like health economics or health insurance for this country. I feel that's also an important area to start with as a common goal. And besides, as a pediatrician, we devote more importance to social pediatrics as a I also give 20-30% importance to social pediatrics. So dealing with most of the health programs in children and how to deal with that and how to move around the new programs also. And two things I feel till now we are not addressing. One is rare diseases or genetic disorders. I feel personally we have a Indian, if you look into the Indian scenario, we have a genetic stable pool. And through now the marriage practices are changing, that can have a possible effect on subsequent genetics in this country, and that may lead to some expression of most of the autosomal recessive conditions may surface it out. So we may need to understand very clearly how our marriage practices will affect on the next generation genetic disorders, how to surface it out and how we can control that as a public health prevention practice. That also I feel nobody is doing. We can look into that area along with genetics and other social line, family practices, or marriage practice, all the things can be linked to that, and we can develop a different area in that line. And health programs, national health programs are going on, but still the challenges in implementation part also, there is an issue in terms of both child health also and maternity and the rest of the programs. I think those areas we can take up gradually, that can think in a different way if you want to introduce some new things other than engage what others are doing.
I think you're done. Yeah. Good morning, Dr. Joe. Good morning, Kriti. I'm Vinod Patro, Professor of Community Medicine here. I think in the room, I only worked in the School of Public Health prior to this. So I worked 5 years with PGI School of Public Health, where it was co-located with the Department of Community Medicine. Having said that, the understanding what we have in the room is biomedical understanding of public health. So there is a big area of public health which does not being addressed by biomedical scientists. So we have to think of who are the right partners for public health. We have to have behavioral scientists, we have to have economists, we have to have health system research, which will be the true public health. Otherwise, we are looking at something called public health medicine. Within the lens of community medicine or within the lens of medical college, we look at public health as a public health medicine. So while those things will take time, I would think what can be done is what sir was just mentioning. We can have a fellowship of 1 year, which otherwise we do give in pediatric critical care or some other specialties. So we can start the fellowship courses as a precursor to Masters of Public Health. So that can be, I think, sir, that is a shortcut or a shorter investment. While the other specialties, colleagues from other specialties, which predominantly, this is a conventional thinking of social pediatrics, social obstetrics, community ophthalmology, preventive oncology, they pair with us because we have a common area of work. But eventually we have to think on social determinants of health. If we don't address through address commercial determinants or social determinants of health, then we are thinking of something which is traditional thinking of public health. So my understanding would be start with certificate courses or fellowship courses like environmental health, health system strengthening, looking at behavioral sciences, or health promotion, health economics, and eventually MPH can be built on with all these as concentration. So first year will be common, second year will be concentration of what I talked about. So it's a good start. There is a need. We require people of diverse background to come in for a common goal, which is population health. While we look at different areas of population health based on our expertise, one has to see individual as a whole. So for that, we require good policies, academic programs, and human resources for that. I think I have spoken more than what is required. Thank you.
Thank you, sir. I think you nailed it.
Yeah.
Because public health in India, there are about 98 schools of public health right now. Approximately about 1,000 plus students are coming out. And most of the schools focus is on biomedical models of public health. And public health is evolving rapidly. If you look at globally at the national level, public health is moving away from PSM as an independent body of knowledge. And you mentioned that it's a biomedical model, and the evolving model is socio-ecological
model.
And within that, structural determinants, commercial determinants also a major role to play, but increasingly health policy. And health policy, then now there is one more issue is coming out. You mentioned about international health, population health, international health, global health. So even public health itself is expanding phenomenally on that. But that knowledge expansion is not captured in the Indian public health teaching and training. I don't know why it's happening, but it's not happening. Because I looked at most of the syllabus and I worked with those schools, so I'm aware of the syllabus. But this is an opportunity for us.
There are 2 reviews which have come recently, which have reviewed all the schools. I can send you. You might have already seen those, like 100 and on. In Orissa, there are 8 schools,
Yeah, right.
8 schools of public health.
Bhubaneswar, there are.
Bhubaneswar 4.
But the syllabus.
PHFI also there.
But the syllabus is, that I mentioned that these are core biomedical models.
Yes, sir.
Because biomedical models, when it's applied to health policy, that is a disconnect comes in. Because the policies are created on social determinants, social response to the social and structural changes. And that disconnect is coming up national health policy and state health policy. These are almost standalone.
Parallel.
Goes on that. And this is one of the major reasons about our policy, for example, primary health reform. And the primary health reform probably look at national level and also state level. based on social and structural approach towards understanding health. So that way, yes, maybe I'll
Yeah.
please.
Good morning, all. I am Dr. Anupam De. I am Professor in Head, Department of General Medicine. So it's public health is need of the hour, and I am really, sir has taken a very nice initiative. And as my understanding is more of there's a lot more, as he has told, than what we actually understand about public health. But from medicine point of view, there are two things which are pertinent. One is metabolic health, because that is the center around which all these diseases work, cardiac, neuro, whatever. Everything is around this metabolic syndrome or metabolic health, metabolic diseases. So this is where we can contribute, because we need to reduce the burden of metabolic diseases. Then we can take care of the larger ones. And the second part is vector-borne disease. Sir is already an expert, international expert in that. So that is an area where if public health is implemented properly, we can have lesser number of cases, lesser mortality, morbidity. So these are two aspects that I see from medicine side, but definitely there's much more to public health. We'll see over the time. It's a fantastic initiative. Will really, it's need of the hour.
I'm glad you didn't say the lifestyle diseases.
I'm Dr. Manaswin Congress, Head of the Department, Professor in the Department of Biochemistry. So, yes, it is a very good initiative. From the Department of Biochemistry, what I feel that the important issue in the public sector to cover, one is newborn screening. On most of the common metabolic diseases of the newborns, which remain unrecognized and never gets manifested. So that is most important aspect to look for. That is in the newborn screening at the time of birth. What we are doing in the department now in the hospital-based study. But if this can be spread to the community, so the children suffering from metabolic diseases which are unknown initially, so they can be identified. So the growth retardation, the developmental problem, but which remains in an unrecognized condition. So that is one important issue. And the metabolic diseases, most important, the non-communicable diseases, most commonly in India, the diabetes, the hypertension, the stress-related problems, usually ignored in the community level. We only think of the professionals who are suffering from the stress-related factors. So those things are remain unrecognized at the community level. The people are poor, people are struggling for many things. So those diseases are remain unrecognized. So by biochemical approach, we have only the field of investigations. So the routine investigations detect many common diseases which remain unrecognized. So nowadays, diabetes, non-alcoholic fatty liver disease, it is not in the rich affluent society disease, it is the disease of the common man nowadays. And the stress-related disease, the poor people in the villages which are more suffering from those, but we are not taking into account. So those can be detected by the routine biochemical investigations which are doing. Now we are doing the hospital-based that can be implemented in a POCT-based into periphery to detect. So those things can be implemented. But as Dr. Vinod suggests, that we are only thinking about the medical aspect. The other aspects are also simultaneously to be taken care of. So that it will be helpful, I think.
Yeah, diagnostic innovation is a major research opportunity. That we can have a community informed or sensitive diagnostic new tools.
Yes.
And because now most of the diagnostic procedure is at the lab, but can we do it on a, because that's one of the areas going to come up, innovation in diagnostic procedure.
So routine diagnostic approaches that can surveillance-based can detect many diseases. And for the newborn, it is the newborn screening technique which can be done in the community. So at the time of birth.
Hi, good morning to everybody. Actually, the last time Dr. Joe Thomas was here, and we were specifically focusing on the global health advocacy. And at that time, what I understood was like start an MPH post for that alone. And at that time, what I understood was it's a broader concept of global health advocacy, not really concentrating on a particular set of diseases or conditions. That's what I understood, but I don't know exactly what is translated after that. So since you're here, I suppose we are going to have some steps into it. So we have not discussed in our department because I got the message that probably there's going to be a local office of SGPH in the institute. And then so the person can take it forward, discuss further. And whatever comes to our department, we are already supportive, as Dr. Vinod said. We will be happy to have any program that is coming for the betterment of the education institution and the population has been most welcome. Corporate.
Thank you, Dr. Akriti.
Hello, everyone. Firstly, I would like to thank you all for gathering here today. And so I have a couple of things to talk about. Firstly, amazingly told by everyone. And so I'll be focusing on a very important area known as dental public health. So I'm not sure if everyone is aware of that, but yes, dental public health is one of the very emerging public health issue that is coming up and it is being neglected. So it is a marriage between two broad categories, dentistry and public health. So what we know is firstly pre-screening. Like as everyone said, there should be a pre-screening for diseases. And that one area I feel is very important. And second is how dental public health is having an impact on economic and opportunity costs due to untreated oral diseases. That is one thing I would like to focus on, and such as community prevention strategies, right? Such as community water fluoridation. It is one of a very important aspect that can be focused on with this wonderful initiative, starting a Masters of Public Health program. And and couple of things such as awareness, increasing awareness, oral health education, nutrition, focusing on nutrition aspects associated with dental public health, and most importantly, I think it is mentioned by one of the professors as well. I think it was Professor Shweta. She also mentioned that geriatric health, it is definitely associated with dementia and poor oral health. So one thing that I would like to talk about. And the other thing also one of the doctors said is, sorry, just let me have a look. Yes, pre-screening for oral cancers and oral cancer burden and diseases. So that's one of the excellent thing that if we could focus on regarding this program initiative. And surveillance, pre-screening, I think that's the most important bit I have in mind. And let me have a look. I think one of the doctors also mentioned about adolescent health and maternal health, mortality rate. I think that is wonderful. It could be, we can find initiatives and awareness programs, how to focus on that area. Yes, one more very important thing is how to focus, what we can do and target the outreach population. So digital intervention, I think it is a wonderful start if we could think about telehealth. I think, yes. And what I feel experiencing and having a public health background is it is very hard to focus on individual treatment, as in behavior of people is hard to change, but having a community prevention strategies will be very effective to reduce the burden of diseases. Another thing is, if one important in public health is the workforce. So if the workforce is there, I think it will be easier to achieve small goals step by step. So I think that will be a wonderful start via this program. Uh, and I think I have covered what I was thinking about. Yes, and I think most important bit is also the policies, strategies and policies to focus on um, disease burden. So finding the risk factors and how we can go ahead about it is the most important. Yes, thank you.
Okay, thank you, Dr. Akriti. And I think the input from the different department and the stakeholders here. So I'm extremely happy that everybody is thinking in the same line to establish the School of Public Health or the wing of to establish, to think, to create one wing, that is School of Public Health. Now, as we discussed, one thing is very clear, that sitting in health institution, always you think biomedical, no, always they're all disease-related public health. And now the burden of the disease that naturally health care setting is, people are coming here, most of the people are diseased. And public health means where we should examine where there is no disease, and the representation from the public sector or community sector that under risk. So evaluation of the risk factor for occurrence of the disease. How we are going to prevent? The public health, I hope, prevention of the disease, understanding the dynamics and understanding the risk factor causing disease. Maybe risk factor, you may have a modifiable risk factor, non-modifiable risk factor. You cannot modify the age-related disease, but yes, you can prevent some, maybe through different ways, your lifestyle and all.
Sorry, can you just add one thing? Sorry to interrupt. I would like to also mention one thing that I might have missed. I think one of the doctors also mentioned regarding sustainable development health. I think that is one key area that we should be focusing on along with the sustainable development goals. So I think that
we are also thinking about that. Yeah, not that one time, always we think how we are going to sustain our program for a long time. I have that acumen, or everybody also thinks in the same line, that is not a one-time job. It is when we are going to start something, always our program to implement and to maintain it for a long time. So thank you for reminding us that all sustainable goal for health development. And now this is we are from mostly medical institution and healthcare setting. So dealing with the disease profile and supporting, investigating from a diseased sample all. Now reaching to the public health, what is actually we are thinking as the behavioral issues, behavioral health is also a challenge, a burden for the public health. Economics, how much we are spending money for the hospital for any disease, whether rational, irrational, and spending for a disease with this. Now, do we need to have a policy? So policy development from this hospital setting to, so it is interlinked. I think we cannot just, so it's now from here, we need to identify the risk factor for why these people are suffering. Why they are so much, the burden of the disease of this community, this group of people. So try to identify the risk and then we go back to the community for preventing this, implementing the policy. So that is how I think our role of public health in this domain, not only just to look for, to provide for services, but to look at the different parameters, indicators, how we are going to really, the neglected area, I think that we don't go for. But yes, there are different departments are there. There's like a psychiatry department. They are meant for treating, but they don't go for the community to understand the behavioral issues at the community level. What is really causing to go for by behavioral abnormality or changes? What are the public health issues? That has to be. So there are, I think, many issues like Here Anupam is saying the metabolic disease. So naturally, metabolic diseases are mostly with the rich people, those who are having money, those are poor people who may not have any metabolic diseases, no hypertension, diabetes. So there's a habit of your eating, money you have, you go on, and then probably those are the factors. And then how to reduce the burden of metabolic disease. That is what the Anupam Day is thinking, to reduce the burden of metabolic diseases in the community. So he has to target which people? He is not going to target the Western people of tribal people because they are working from morning till evening. No point targeting those people to identify the risk factor for metabolic disease. You have to go for rich people in the city, urban population to target. So that is how we have to establish. I think there are many models to examine and there are many issues, challenges. It's really a challenging issue. It's not easy and not one model is going to answer for everything. So there's a brainstorming, I think, session everybody is getting and how to reach that the investigation pathology. Yeah, telemedicine we have at this moment history, and then we give the medicine treatment and we write it. But pathology is such a way the specimen has to be transported, and then here we will do this and to reach to the community. It's not a verbal, but yes, if they can send it through, and we have a mechanism who is going to what type of sample, is it a oral sample or liquid sample or it is solid sample? If a biopsy is needed, now we have to tie up with some center in the community who can do some biopsy and send the samples to the designated center that we create at AIIMS, School of Public Health or any pathology department for any. So they can send and then we can reach to telemedicine for providing, for giving services. Yes, you are not having cancer or you're having cancer, you come to this place, this date, this department for treatment of cancer. It's a very good initiative. So we need to have also for that manpower to provide. So it's a challenge for everything. And let us hope how we could do. So as nursing, I think School of or nursing is also working on community health medicine, community medicine and all. So how they're going to really improve and work in they may be posted or we have to understand how their job is. They are coming for degree. And now within that period, they have to also get the degree and also do some public health, community health services. So how much time they have. And from that time period, they have to be deployed in a different institution to understand, to also know. So we have to develop a model. I'm not sure how this would be. And I was talking to the university, Utkal University here is one university, they are having Department of Economics. So last year I was there for some inauguration, something. So I talked to some HOD of the economics. So I told I am very much interested about the health economics. So they are very much thrilled. Yes, I am there too. So I'm going to tie up with these people, public, those who are not related to the medical college. Their health economics, the different ways they are taught, they calculate them. So I try to know how we are going to develop a model of health economics of AIIMS Bhubaneswar. So that way I'm not sure. So these you people can tie up. I have not much time to discuss and all. So probably then my job is to facilitate. So then probably you people have to think how the economics of the health in AIIMS and then how it's going to bring the changes in the policy. Yeah, we should understand. I'm not sure how much we are antibiotic using, how much cost for the antibiotic use for abuse or use or whatever we misuse. And then probably if you go for rational use of antibiotic, how much money that we can reduce unnecessary for any disease. So economics that going to tell us that this is what and this is how your policy should be changed. So probably we have to reach out to the other, not the biomedical, the universities. Behavioral science, there are many other university, not the our secretary department. Okay, so we need to understand from them behavioral science and other sciences how they really think about the public health, and so that I think will open up many channels, many things. So yes,
Sir, actually, what you are telling, public health people are not looking into social angle. What I feel in this country, we have sociologists and anthropologists. They are mostly looking into societal angles. So many university, I think even Koraput Central University has a good, very good anthropology department. Here also, social and anthropology departments are there. They are doing many good studies in societal changes and social transitions also. So they can, as I told, they can be also collaborate.
Yeah, we can explore and then we can tie up with them, have a collaboration, and we can develop these models. Yes, I think now it is over to you. Yes, Dr. Joe.
No, thank you, sir. Anyway, there's a formal announcement that AIIMS Bhubaneswar is going to open a school of public health. That is on record now. Thank you. Thank you.
Thank you very much.
We have an opportunity with this school. The opportunity is that we one step ahead of all other schools of public health on syllabus, on opportunity. So this is the one thing. And also there are some of the emerging opportunity which other schools have captured it. And I wanted to, maybe I have a slide. Maybe I can.
Yes, yeah, slide, Chala.
You can see. She can see it. Two slides. Yeah, maybe I'll show you. This one.
Mouse per dedo, no?
Most of the.
No, it's okay.
Yeah.
Okay, just a brief introduction. So one is we have an opportunity to look at what are the other syllabus offered by this 98 schools of public health and what we can do, what we can take it forward. And I would look it as a kind of opportunities which are not explored properly. Opportunity in the area of syllabus, opportunity in the area of vision and mission area. These are two areas. And this opportunity is also, most of the schools of public health, they look at internally, national level. Now we have to look at the India's transition on the global level. And also we have to look at diseases normal boundary level, national boundary level. So how public health is respond to this global transition in health. This is one issue we have to look at it. And the third, India is playing a different role globally in terms of vaccination, vaccine production, in terms of manufacture generic medicine. And also India signed about MOUs with more than 60 countries on different aspects of public health. And what I'm noticing is that maybe the public health students may contribute on a global level also, maybe about 5 to 10% of the entire workforce. So we have to have some attention on the possibility of training students for the global level. And another interesting thing is that global leadership in public health dramatically changed. United States withdrew from the support for WHO. The immediate impact is that about 2,000 actual position is removed from WHO. They need to replace it. And many countries are competing to fill in that position. But we are not prepared to capture that. So this is an opportunity which national level, on a national interest point of view, we have to prepare that. And WHO may not, US may not come back immediately for the next 5 years. And another interesting factor is that there are 75 WHO collaborative centers in the United States. Maybe as AIIMS as an institution can look for which WHO collaborative center you can bid for it. So this is not a school of public health issue. Just give another opportunity there. So this is an opportunity to strengthen our institution mechanism. So that way, there are national opportunity, global opportunity. That also should be factored into our syllabus. This one I just want to briefly say in the introduction.
Arrow, I think, put an arrow.
Okay. So a full spectrum of public health education, maybe the possibilities for PhD, DR, Doctor of Public Health is not given in India, maybe that we can explore. Diploma, certificate, and short course MPH. And also most important, leading national think tank on public health policies in India with a global focus. That is an area which is not explored by others, possibly other schools of public health. So this is one of the niche areas emerging because health policies are important aspect of resource allocation. The policies to determine the resource allocation both ways, national policy and the state policy, and also integration of these two very limited discussion takes place. And again, I just mentioned about India's emerging role, then the changing global context and leadership in public health, how we prepare our students to capture this opportunity. And the new School of Public Health focus on a global health, because global public health could be one of them. It may be a calculated risk, I would say that. At the same time, number one, there is no other prominent schools in global health. So this is one area we should explore very strongly on that. And leading National Center for Training, Research and Global Health on disaggregated data. Now the data revolution, we talk about it, but data management, because simultaneously state level, national level, there are different public health research is going on. But all these variables are not comparable because we don't have a standard policy on disaggregated minimum essential data on at least on demographic variable. Any study, any research, the demographic variables, disaggregated demographic variable should be standardized. This should be a national policy, or this idea should come from the research institution and public health institutions. And again, connecting local health issues to broader global health issues. And we talked about Sustainable Development Goal. SDG 3 is particularly about health. But these SDGs are time-bound. 2030, we are supposed to reach, I think, 23 targets in the global health. But we know half of them will not be met. So now there is a discussion is taking place. What do we do with unfinished SDG agenda? And that leadership role, what are we going to do about unfinished global health agenda and who will lead that? Because the US was traditionally leading that discussion. Now there's an intellectual vacuum is coming up, whether we can contribute towards that. And the scope is academic program, research innovation, policy engagement, global South-South leadership, career pathways and system impact. This is broadly, I just want to briefly mention about it because students are coming to get a diploma certificate. They also have an eye on what are the career opportunities. Yes. So I just want to mention that also what's coming up. So academic program just mentioned what are the possibilities. I'm not getting into detail. Research and innovation, probably this is one area we might look at carefully. Research in the area of diagnostics and a diagnostic which are adapted to the Indian condition and whether we can share with the global community. The innovation in the area of diagnostics is an important area. And also there are handheld and also community-based diagnostics coming up. Then assistive technology is coming up. How do you support assistive technology in terms of access, quality assurance, and also availability? That was a public health issue. So innovation, I just briefly mentioned about two. And also policy innovation, because we are talking about financing model. Because increasingly, the insurance model is coming up, but the insurance model, how much on a long-term basis, how much India should rely on that? Whether we should have cut off not more than 20% of the health financing should come from insurance. Because if you look at the insurance example is United States, one of the worst healthcare systems in the United States, but it's almost completely insurized health system. And the insurance agent is deciding your healthcare, not the physician. So that level things moved on. And on a policy level, how we're going to look at this issue, the insurance industry in India and privatization of health system, what's happening on that. So these are the few areas on policy level we might look at some innovation. And the policy engagement I just mentioned. And also I mentioned about India's possible role on global health. Global health, we broadly call it as global health diplomacy because many of the negotiation, now India signed a trade agreement with European Union. It has got very significant health related implication. And we don't have a very strong manpower to look at implication of the free trade agreement, how it's impacting on health and well-being. So these are the issues to advise the trade department that what is the public health impact it should come from institutions like this. And also, the Global South leadership is actually a new way of understanding developing countries. So we call it a South-South collaboration. So India is, as a traditionally, the leader of developing countries. So that includes contribution in the area of public health in terms of calamities, natural disasters. I was looking at India's contribution towards Nepal earthquake. About almost human power, if you look at about 100 doctors went, and also the medicine was sent. And it was just written as 100 doctors went to Nepal. But US sent $1 million for Nepal earthquake support. If you look at that 1 million and this 100 doctors, I mean, we never looked at the financing economics of dealing with the natural calamities. It is probably $10 million worth of services we provide. But we haven't captured, we never thought about the diplomatic opportunity. India's contribution to diplomacy in Nepal, and probably it's about $10 million worth of it. And that negotiation, that discourse is not coming up because we haven't looked into that, we haven't prepared to that. And this is one issue, like the career opportunities. My assessment is that global health is going to contribute 5 to 10% of the workforce from India. And they should be trained and they should be linked with opportunities. And also we should be aware of what are the global health institutions and how do we access them, how do we engage with them in our teaching, training, and also research, bidding for the research from them, particularly on WHO, UNICEF, UNFPA, Gates Foundation. These are some of the leading players in the global health. So how do we engage? A public health institution with a global health focus, we place ourselves in a better position to capture this opportunity, which invariably support our student outcome and their opportunities and also their exposure. And when you look at developing a syllabus, there are different ways to develop a syllabus. One is you select few things here and then put it together and create a syllabus. We look at carefully how they create syllabus, what is the principle behind the syllabus, what is the theory behind the syllabus. This is an important part of, because pedagogy, the teaching of public health is becoming an important part of the next generation training. So one is the core competencies of public health. So this core competency approach is developed by WHO. And also there is a CDC core competency approach, but I didn't go much into CDC because US leadership is changing dramatically. So we should not bet too much on the US because US competency-based public health education mostly for the US related opportunities. So maybe we should look at what is the WHO competency, what they're proposing, because this may be useful for the other non-US related opportunities. So this is one deliberate decision. I'll explain about the legitimacy behind it. And because they are much more competent to take up opportunities in European Union and non-US related institutions. And the list of core competencies, these are analytical and assessment skill, one of the major competencies, policy development capacity and program planning skills, and the communication skill. This, you may be finding it a little strange, that communication skill, but public health candidates' communication skills, particularly using the social media and the new media opportunities and the traditional communication opportunity. Cultural competency skill. This is very important for the cross-cultural explanation and the teaching, because when Indian students move to another country, that cross-cultural competency, even within the country, this cultural competency, how do you teach them? Then a public health science skill, community dimensions of practice skill. And the last is leadership and system thinking skill. How do you think for public health? There are different theories, models. How do you apply for thinking? The system thinking is emerging as one of the major approach in public health problem solving. So these are the competencies which I'm planning to apply on the draft syllabus which I'm proposing. So what I'm proposing is a 2-year, 4 modules, 4 unit kind of thing. And the core focus area in the domain: health system, global health, epidemiology, social and structural determinants of health, primary health, climate and climatic crisis we should use now, climate and health, maternal and child health, mental health, public health laws and ethics. So these are the core focus of our syllabus. And also, I could suggest one more thing, because we are sitting with a very experienced expert sitting here. All of you have some core expertise, and which can be drawn in and create along with that. So these are the core competency. Along with, we can have opportunities at other courses. And each faculty can develop their own area of expertise and giving it as a supplementary program or a separate program, standalone program. This is one thing we can explore it, each faculty, because we may not be able to get immediately new 7 or 8 public health faculty, but each one will be one area you may be focusing on and providing it as a kind of a standalone program along with the main course, or it itself can be a certificate program or a diploma program within the School of Public Health.
So can I just add in a few comments? What about disaster, war prone zones?
No, war, but it's coming to that. This is the area I suggested that disaster management and also the the issue of humanitarian health.
Yes.
Because humanitarian health has become very important. Refugee health, Gaza place population. Not only Gaza. If you look at India is a major recipient of refugees, displaced people. Our neighboring countries, huge displaced population, because there's 3 words are there: displaced population, refugees, asylum seekers. The health issues and access to health, there is a variation into that. I didn't get into that. Anyway, one of my book is on refugee mental health. So that is my passionate subject. I thank you for mentioning it. So along with that, there are many other issues coming. For example,
Sorry to interrupt regarding the disaster management part. No, the government of India, the Minister of Health has their policy, and we have been working on it already. The Bhisham Cube, you are already aware of.
Even this week it is going on, the disaster program.
So that is one, that the Vision Cube is, you might not be knowing what the policy is. That, there are many cubes there where we can transport these cubes to the site of disaster. And that cube to carry all the equipments to set up a mini hospital, including the OT and the ward, and providing the surgical as well as the ventilatory services on spot. So the medical team will rush to this hospital, that is the cube, and may be transported by the truck, or if not, the roadway any difficulty, so it may be transported through the air ambulance. That is one. Second is that we have a CBRNE, the program, looking at the government of India now, looking at giving importance to 2 aspects. One is the defense, another is the health. So now health, that we are going for CBRNE. So CBRNE, that is chemical and biological, nuclear, and radiation exposure, the disaster because of the impending world war or maybe atom bomb or nuclear bomb and all. So this training program is going on, and we are going to have a building for it. We have identified to address that issue. So we're going to have the separate wings to address those disaster management. So is a School of Public Health, that's a small one, but as a big one, providing the service. But at the same time, yes, you can think of how we can prevent all the
like in famines and all.
Man-made disaster or natural disaster. So there are many ways that now its training program is going on. AIIMS Bhubaneswar is giving the training to the eastern region, that is the 4 states where
that training could be provided as a certificate or diploma. It may be standalone certificate, just the attend and go.
So yes, that could be for a disaster, but that is a Minister of Health program. Identified AIIMS as a center of excellence in training in the eastern region for 4 states: Odisha, Chhattisgarh, Jharkhand, and Telangana. So the government of India has made the region east, west, north, and south, and the region, the AIIMS Bhubaneswar is leading in that, providing the training for these 4 states.
That training could be converted as a diploma.
Training,
certificate by AIIMS Bhubaneswar, School of Public Health. That could be the
yes, that could be done. Issued certificate by the School of, not AIIMS.
AIIMS School of Public Health. There's a year 1, semester 1, foundations of public health. So these are the issues which are listed. We have to package it as a syllabus. That's a different issue. History and philosophy and core functions of public health, principles of public health, basic concepts, descriptive statistics, probability, and of that introduction to statistics, biostatistics methods, structure, financing the governance, reform in health system, policy and health system, then environmental and occupational health, air, water, sanitation, climate, and workplace health in broader sense in the public health, then a right-based approach, legal framework, and public health ethics, law, and ethical dilemma. So this is the semester one as a foundation of public health. So this is probably about six credits. And second, semester two is about epidemiology 2, biostats, social and behavioral health, introduction to research method, that both qualitative and quantitative, health communication, and the field practicum. Maybe one, this is semester two. This field practicum can be shifted to the third of it also. Then year two, specialization practice comes in the year two, and the global health SDGs comes in. Then the program planning and evaluation, elective one, that is choose elective one from maternal and child health, NCDs, mental health, climate health. So the elective we can give 4 or 5. Then elective 2 is from health informatics, disaster management, health economics. So these are the elective 2. This also we have to little more carefully, we'll come back to that. Then leadership and system thinking, strategic planning. How do you help strategic planning, methodology and approaches strategic planning? Then change management and intersector collaboration. And the field practicum 2, thematic placement with NGOs, government or research institution. And year 3, the final semester, the capstone project, thesis, independent research project or seminar series. So this is the overall thematic, the framework of our syllabus. So what I was thinking that if you give a green signal, okay, this way we can go, I'll create the detailed syllabus and including the teaching methodology, class notes, all this full package of teaching syllabus, I prepare it. And also we look at assessment pattern and all other things, including a prospectus, a draft prospectus for sharing it with the students. So this meeting is to seek that guidance towards developing a green signal for developing a final syllabus, even that as a draft. And also selection, recruitment, and also the practical assessment, all this will be as part of this, the detailed syllabus. So then I also looked at the cross-cutting themes, cultural competency, community engagement, advocacy, policy influence, data literacy, data visualization, because new software is coming up, ethics and equity. So these are cross-cutting on all the subject, all the units are coming. We are talking about approximately 12 units for the 4th semester, and plus or minus if they offer for the research project or a field placement, this maybe have some differences. So we are looking for the 12 thematic area and one faculty may be covering one. So we are looking at areas of expertise in 12 areas within the existing team and under one coordination, then maybe structurally that as an institutional thing you move on. So this is the general outline. If you think that we are moving in the right direction, then I'll go to the detail when I'll come back with them for the submission for the academic council for the final approval. So this is the plan I was thinking about it. So anyway, so we had some various discussion about it. So one thing, I'm glad that, there is a formal decision about the School of Public Health is going to come up. But now how to utilize this opportunity to the maximum, the better, the teaching and research area and place AIIMS Bhubaneswar on the top level or national level, and also regionally and internationally relevant one. As a goal, we set that as a regionally relevant, globally competitive public health institution. So this is a vision I'm presenting here. Thank you.
Can I just discuss one? One minute. Regarding this health communication, I feel one part of public health journalism is an important area because most of our Indian health system is changing by media influence. So we may, can you include, do you understand that is covered under that, or we can have a related?
I have vested interest in the area. I'm the editor-in-chief of a top public health journal. And I look at critical public health. You can take a look at it. Yeah. And what I notice that I look at globally, I get submission and I approve about 250 to 300 papers in a year. And India hardly 2 or 3 papers in a year. But also interestingly, that shift has already taken place Chinese researchers. I get about 40-50% of the publications in China now. But mostly what I notice is they look at quantitative public health, not necessarily policy related college. So that's what is missing from them. But as a critical public health, I look at what is the emerging issues. What should be the new one? For example, I was talking about one next colleague here, the textile public health and how textile industry is public health informed, because hospital gowns, whether it can be germ proof or virus proof, that kind of research. So I'll just give an example about it. So, and again, we're talking about One Health. How do you integrate the data from veterinary science to public health? That's one issue coming up. And there are many cutting edge issues are coming up. How do we capture it? So this is, again, in a global health diplomacy, I was suggesting that how do we take leadership role in WHO? And for example, senior level, D level, hardly any. There are more than 300 positions are there. And there are only 2 Indian people with Indian background with D1, D2 level. And deputy director level, there is absolutely nobody. But this is an issue which we haven't thought about an active policy on Indian health diplomacy. And maybe a roadmap towards Indian health diplomacy can come from here. You propose how do you operationalize global opportunities in public health. And in many countries, they have a global ambassador for public health. And why this is important? Because India is a major pharmaceutical of the world. And we can influence on the pricing, local pricing, national pricing. This all worked on the global trade agreement level. So this is a potential and opportunity for the institution. And I thank Sir for that, taking that and grabbing that opportunity. Thank you.
Thank you. So, any quick suggestions?
So I think the framework looks fairly, I think, very good. But I think all of us should get some chance to go through so that we can come back with our comments and.
So my suggestion is I'll draft it and send it for the feedback and comments.
Yes, yeah, so that it can run through everybody.
I think it's wonderful. Thank you, Dr. Joe, for giving your very important, this pathway, the guideline for framing our course curriculum for the MPH program. And I think next is that Dr. Joe will be giving some documents, so we'll be circulating each and to go through, and then some comments from your side, and then we'll finalize that document. Okay. Then through this, Dr. Sonu, that Dr. Joe will be preparing the draft, and then it will be circulated to everyone for the comments and suggestions, and then we'll make it maybe one meeting for finalizing, that internal meeting for finalizing that course curriculum, and then to make it how we are going to approve it. So that would be placed first in the next academic committee, and then probably we'll put it into the SFC, and then we'll see how SFC is, maybe there should not be any objection if we want to run it under any department. Suppose your department is the same FM, so without any cost, then the government Ministry of Health will be very happy. If we put some money into it, then they will be hesitant. So first go that we are going to have the School of Public Health. And in future, so maybe in one that we can request for at this moment 1 or 2 for the PhD students, or maybe diploma. We'll think about that, how we are going to work on it, and where from you'll get that resident post to create or to divert. Do we appropriate that? We'll have another meeting when our course curriculum will be at the final stage after getting the document from Dr. Joe, and then probably heading for a different center, a center exclusively interested faculty members to work in that. So that will be a group involved in the School of Public Health, and then how to run and what are the resources to run, and then the collaboration research program with the different institution to collaborate, like as I said, different universities to look into. So we'll have this group and then probably go for it. And they are coming all the way, supporting, traveling. Really, we are extremely thankful for your support and guidance.
Thank you, sir. And interacting with some of the best brains in the country on public health. Thank you for the opportunity.
Thank you. And I hope this all, and to begin with, the community medicine and family medicine department will take up the job, and subsequently all other department and all will think how they're going to strengthen the program and tie up and what role they're going to play. So we'll finalize that later. We'll have the internal meetings maybe 2-3 times before we finalize it.
So let me promote my private agenda. Please think about publishing in my journal. Take a look at it. And I'll be happy to provide technical support to bring it up on the international level.
Thank you so much.
And anybody, you or even your students, I may be able to help them to take them through the review process.
Yeah, so he is the chief editor of this critical public health journal, which is in text and maybe 3-4 factors. So it's a good journal, critical care public health. It's a rare, I think. So we have to think critically before we send an article to him, critical journal, public health. But this is chargeable, about more than 2,000 Australian dollar the charge for publications, 2,600 or 800.
No, it's a pound. It's pound. It's from coming from UK.
Okay, it's a pound.
Pound.
So 2,000 pound.
John Thomas will give us a waiver.
Yeah, actually, there is a provision. I'm not disclosing it because I may not be able to cope with the demand value.
So it's published from UK, and he's living in Australia, and now currently in India.
Global citizen.
And he worked for many years in China also. He worked in Hong Kong,
East
Timor, and visited Timor also. He was trying to know the story of my visit Timor recently. I visited 3 times this Timor. No?
I was advisor for 3 years there. I lived there.
Okay, so they called me 3 times. I don't know. I said no more, but still, WHO is not leaving me.
The East Timor disease profile is almost similar to ours. That's it.
Yes. So vector-bound, there's emerging infections. So anyway, the government is very they're liking me the Tetun language that you might know.
No, they have a history with India, so I'm not getting into that.
Yeah, that's
the Portuguese. East Timor was a Portuguese, what do you call Alapani from India. East Timor, they used to send East Timor, that's it.
Goa and also that is
similar to Goa. Anyway,
that is a different story. Okay. Anyway, so thank you very much for giving your valuable time for a very valuable cause. And hopefully we'll be able to click it as quick as possible. So now the first that we're expecting a draft from Dr. Joe, and he has already made a draft and he has given already to us. And then probably if anything that you're going to correct it is okay. And the edited version maybe we are receiving soon. So I'm planning to have a timeline for it. So our timeline is that next year we are going to start and with a course, maybe either diploma or a fellowship or anything. And that's our agenda. And before that, the 6 to 8 months, our program should be ready to launch. And my job is to course curriculum to be approved by the different committee. SFC and all that. That's my job. But before that, I need a final draft and how we're going to the work and all. So we'll have a meeting and we'll discuss after this. Okay. Thank you very much, Dr. Joe. Thank you. Thank you, Dr. Akriti.
Thank you. I have a request. I have a small request. Can I get a document of everyone's name and their email address as just to keep a
Sure.
store a documentation?
Yeah. And Dr. Swayam Pragya Farida is the nodal person for communicating this all. You can have it, you can note down the number and
Yes.
then you can communicate with to all communication. All right?
Okay.
Yeah, group photo like this. Okay, you can come here. It's a group photo. It's going to buy. ये नंबर ये फोन लो सार्च करो कारण को भरोसा नहीं हम ऊपर तो बुझी पारिबे नहीं और जेटा सेटिवें पहुंचे प्लीज यस अजय come closer yeah no, not blocking. Yeah.
Maybe you should get the same.
Yes, yeah.
Historic document.
ହେଲା but ସାରଙ୍କର ମୋବାଇଲରେ ନେଲା ସେଇଟା ଭୁଲି ଯାଉଛ କଣ I know that's fast but AIIMS उधर एक AIIMS please request to जो AIIMS बाहरी करते ना जाओ बाहर कर लेंगे तो अच्छा है तो AIIMS तो लिखा है ना सर बाहर भी है ये आउटसाइड इट इज बेटर मतलब फॉर्म लिखा हुआ है तो लोग आई थिंक सो मैं देख लो एक बार स्वयं देख लो
How are you?
Hello, sir. How are you? Good. How is it going?
We'll discuss later. Okay, sir. Take care. Bye.
Bye, sir.
हम लीव कर रहे हैं, ठीक है?
It's not coming very good. Come at least inside. आई है ये AIIMS नहीं है सूची हो गया अजय let's go. Oh, okay. Is it okay? Okay. On the again, वैसे घूमना पड़ेगा वो कैमरा कैमरा नहीं दिखेगा अल्लाह इधर तो हो जाएगा कैमरामैन उधर है इधर तो नहीं कर पाएगा चलो
सब दिख रहा है ना
समझते हैं अल्लाह सारा कैमरा पे बटन नहीं है तो ऑस्ट्रेलियन कैमरा एक कैमरा
मेड इन चाइना
वो तो हम नहीं बताएंगे